Today I'm going to say things that may shock you, things that contradict what you've heard from other doctors, things that go against traditional medicine, but after 30 years working as an orthopedic surgeon, I can't stay silent anymore. Traditional knee pain treatment doesn't work, not for most people, and I'm going to explain why. You see, I have no conflict of interest in this admission. I've already built my career. I performed thousands of surgeries. I could continue doing what I always did, following protocols, not asking uncomfortable questions. But my conscience won't allow it because I see too many people going through traditional treatment system and not getting relief, or getting it temporarily only to return months later with same problems. Let's start from beginning. You come to doctor with knee pain. What happens next in traditional system? Doctor asks few questions, conducts quick examination, orders X-ray or MRI, you do scans, bring results. Doctor looks at them and says, here's your problem. You have arthritis, or you have meniscus tear, or you have inflammation. Then writes prescription, anti-inflammatory pills, chondroprotectors, maybe referral for physical therapy. Whole appointment takes 10, maximum 15 minutes. Sounds reasonable, right? This is standard. This is how medicine works worldwide. But here's the problem. This approach is based on fundamentally wrong assumption that what's visible on scan is the cause of your pain. Multiple studies over past 20 years prove this isn't true. One of most landmark studies was published in Medical Journal, where scientists did knee MRIs on a large group of middle-aged people who didn't complain about pain at all. Guess what they found? Most had structural changes, meniscus, degeneration, cartilage wear, bone changes. But these people felt no pain, absolutely none. Now think about opposite situation. How many people come to doctors with severe knee pain and their MRI shows minimal changes or nothing substantial at all? I've seen hundreds of such cases. Person literally crying from pain, can't sleep nights, and scan is nearly clean. This should tell us something. This screams to us that connection between structural changes on scans and actual pain is very weak. But traditional medicine continues treating the scan, not the person. Let's continue. Anti-inflammatory drugs, ibuprofen, diclofenac, naproxen, all these medications prescribed to millions with knee pain every day. Yes, they reduce inflammation. Yes, they can temporarily relieve pain. But here's what they don't tell you. They don't treat the cause. They just mask symptom. And worse, with long-term use, they have serious side effects, stomach problems, ulcer risk, kidney stress, increased cardiovascular risk. But most insidious, they may slow tissue recovery. Inflammation isn't only bad, it's also part of healing process. By chronically suppressing inflammation, we may prevent body from fixing itself. Chondroprotectors, glucosamine, chondroitin, billions of dollars spent on these supplements annually. They're prescribed by doctors, advertised as a way to restore cartilage, stop arthritis. But you know what quality studies say? Their effectiveness doesn't exceed placebo. Large, well-designed studies repeatedly show these substances don't provide meaningful improvement, but industry thrives because people desperately seek solution. Corticosteroid injections, shot in knee, that gives relief for a few weeks or months. This is popular treatment, especially when pills don't help. And yes, many people feel improvement after shot. But here's what research shows about repeated steroid injections. They're toxic to cartilage. They can accelerate joint degeneration long-term. You get short-term relief at cost of long-term worsening. Hyaluronic acid injections. This is another popular option. Idea is you inject substance that acts as joint lubricant. Sounds logical. Problem is, studies show very contradictory results. Some people say it helped, many doesn't help at all. Effect often no better than placebo. But it's expensive, very expensive. And insurance companies pay, clinics earn, patients hope. Now about surgeries. Arthroscopy for joint cleaning was one of most common orthopedic procedures for decades. Idea is simple. Enter joint, remove damaged meniscus pieces, smooth rough cartilage, wash joint, seemed reasonable. Problem is, studies showed for most arthritis cases, this procedure isn't more effective than sham surgery. Yes, you heard right. There were studies where one group got real arthroscopy, another got only skin incisions but didn't enter inside. Results were same. This was powerful placebo effect of surgery. After these studies, recommendations changed and arthroscopy for arthritis decreased. But still, millions of such surgeries performed worldwide, often without solid grounds. Joint replacement, total arthroplasty, is different story. This is serious surgery for serious cases. When joint is truly destroyed, when person can't walk, when pain is unbearable and nothing else helps, replacement can be lifesaver. And in these cases, it works. But problem is threshold for recommending the surgery constantly lowering. People with moderate arthritis who can still function are increasingly offered arthroplasty, and not all get good result. Some continue experiencing pain even after joint replacement because, again, joint wasn't true pain. So why does all this continue? Why does healthcare system keep using treatment methods that don't have solid evidence base or have limited effectiveness? Answer is complex and multifaceted. First, inertia. Medicine is conservative profession. What doctors were taught 20 years ago, they continue practicing today, even if new research shows there are better approaches. Changing practice requires time, retraining, willingness to admit what you did for years may not be optimal. Second, time. Traditional approach is fast. Looked at scan, wrote prescription, next patient. This fits system where a doctor must see 30 to 40 patients daily. Alternative approach, functional assessment, movement observation, biomechanics check requires time. 30 minutes, 45 minutes per patient. System isn't designed for this. Third, money. Pharmaceutical companies earn billions on anti-inflammatories and chondroprotectors. Clinics earn on injections and surgeries. Implant manufacturers earn on arthroplasty. This whole industry built on current treatment model, telling patient, your problem is biomechanics. Here are exercises. Do at home. This doesn't bring money to anyone except patient who will save on treatment. Fourth, patient expectations. People come to doctor wanting quick solution, pill, shot, surgery, something done to them or for them. When doctor says you need to change how you move, strengthen certain muscles, it'll take several months of regular work. Many get disappointed. This requires effort from them. This isn't quick fix, easier to swallow pill, but here's harsh truth. For most people with chronic knee pain, there are no quick solutions because problem isn't joint structure that can be surgically fixed. Problem is how body functions, how it moves, how muscles work or don't work. And this can only be fixed through functional rehabilitation. Research confirms this. More and more quality studies show exercises aimed at strengthening muscles and improving biomechanics are as effective or even more effective than surgical intervention for many knee pain cases. But these studies don't get such publicity. They don't create headlines because do exercises isn't sensation. I've seen transformation of hundreds of patients who suffered for years, went through traditional treatment without result, then started working on biomechanics and recovered, completely recovered without surgeries, without constant injections, without daily pills, simply through understanding their body is system and through restoring proper function of this system. This doesn't mean traditional medicine is useless. Acute injuries, serious ligament ruptures, completely destroyed joints, all require medical intervention. Diagnostic imaging important for ruling out serious pathologies. But for a vast majority of chronic knee pain cases, traditional approach treats wrong thing. So what's alternative? Functional approach. Look at whole person, not just joint. Observe movement, assess biomechanics, check muscle strength and balance throughout kinetic chain. Find true causes, stabilizer weakness, certain muscle tightness, wrong movement patterns, and then systematically correct them through targeted exercises and movement retraining. This takes time. This requires patient effort. This doesn't fit quick fix model, but it works, really works. Doesn't mask symptoms, but eliminates causes. And results are long-term because you're changing how your body functions. Here's what I want you to understand. If you went through traditional treatment and it didn't help, this doesn't mean you must live with pain. Doesn't mean your case is hopeless. It may simply mean you were treated for wrong thing. Find specialist practicing functional approach. Be prepared to work. And there's a very good chance you'll find solution traditional medicine couldn't give you